eliciting. Yeah. Yes. Yani the topic of this unit is eliciting the history. Eliciting the history is the topic, but this is the topic of this passage. But the topic of this chapter is working in psychiatry. Working in psychiatry is the topic of this chapter. But this topic, eliciting the history, is the topic of this passage, in fact. Right? Let's start from here. That what is psychiatry? Actually, as on that day we discussed that psychiatry and psychology are both interrelated fields. In psychiatry, the doctor treats a patient with medicine and with advices. He gives advice and he gives medicine as well to the patient for his treatment. But in psychology, the patient gets only advice. The treatment is completed or is done with the help of advices there. So psychiatry and psychology both are interrelated. They are actually related to each other and they are almost one field actually, right? Yes. Here he tells you that about the topic of this passage is eliciting the history. Eliciting means taking or drawing or making any conclusion. Actually, when a person or a patient comes to the doctor tries to ask him some questions. And with the help of these questions, he tries to understand his symptoms or his disease. He is diagnosing actually. He is trying to find out the reason of his sickness. And this is known as history-taking procedure. History-taking procedure of that particular sickness, in fact. So he says that in this passage, he is telling us that how can a doctor take history about the patient's sickness. So this is our topic today. And how can he take history about the patient's disease or patient's problem. As I told you earlier, that whenever a doctor goes to the patient, he tries to get information about his problem, in fact. So actually he writes all the notes on a file, and then he tries to understand that actually what is his problem, in fact. Right? So actually this topic is known as eliciting the history. It means that drawing, meaning getting information, or taking the information, or history, okay, or concluding the history or information after listening the answers of the patient. Yeah. So this topic is related to taking history. Clear? Now he says that when a person is trying to get information about the patient's sickness, actually he is making a kind of interview. He is interviewing with the patient actually, and in interview he is asking different questions about the sickness. Okay, so then he says that when he is going to have an interview with the patient, then the doctor should be careful for these things when he is going to take interview. Maslan, first he says that when he is asking questions, he should not be in hurry. He should not be in a hurry means he shouldn't be in a quick mood to ask questions and then expect answers. No. He should not be in a hurry. He should not make all the questioning in haste. No, this is not a good thing, because the patient is maybe new or stranger to the doctor, and then maybe he can have a problem to answer the questions very quickly. So now this is advice this is an advice to the doctor that he should not be in haste. He shouldn't be quick to make questions to the patient there. Right. Then he says that ask initiating questions. Asking initiating questions means asking very simple, very easy, and very common questions related to his personality. How are you? What's your name? How old are you? Etc. Any
question about the person.
Exactly, to know about the persons. And the other thing is this, that to make trust, to develop trust, sikha, between doctor and the patient. So this is also kind of important thing for them. So this is also important thing, that he should ask very initial questions, very beginning type of questions that related to the personal information about the patient here. So he should have initiating questions in the beginning, right? And I told you examples of initiating questions there. Then he says that why the GP refer. Now the doctor will also try to know that what is the reason that other doctor, Tabib Aam, other doctor, yani general physician, has sent him here. What is the reason? How and why the doctor has sent him here? What is the reason? Okay, so he should know about it, because when he will try to know about this thing, actually he is trying to know about the problem, because the doctor, general physician, maybe he has given him a kind of referral letter, tahveela, warqa tahveela, okay, mumkin he has given him there, and then when he has given him, then the other doctor can read, and then he can know that what is his problem in fact. So then it means that general physician's diagnostic information can help to the other doctor there. Okay, then he says that when the patient is giving answers to the doctor, he should not interrupt. Interrupt means muqati. He should not cut just on his way. He should not stop on his way, because when he is giving information, okay, let him give the complete information. Don't stop him. Okay, so these are the things. These are the qualities about the good interview actually. So when a person, when a doctor is taking or making interview with the patient, so then he should be careful for these things. He should be careful for these things, that he should not haste. He should not make all the things in haste. Then the other thing is this, that he should ask or he should start his interview with beginning questions. He should not interrupt, okay, on his way when the patient is giving information. And the last thing is this one, that the patient should not be interrupted. The patient should not be interrupted. That he actually whatever information he is giving, actually he should give all the information just properly. So these are the characteristics. These are the important points about an interview which is going to be happen between doctor and the patient. Clear now, right? Now the second point is this one, that actually up to this one we have finished the first paragraph. Up to this one we have finished the first paragraph. Now if you open your books, please open your books and read the first paragraph, then you can find out that in first paragraph he is talking about all the things related to these points. First he says that introduce yourself. See, in your practice, doctor will start his interview by introducing himself first. Okay, then he says that introduce yourself, explain to the patient how long the interview will take. Explain to the patient that how much time you are going to take for this interview. Okay, the doctor will explain to the patient that how long this interview will go. Right. Then he says that find out how the patient came to be referred and what his expectations are. Maslan, we will try to find out, the doctor will try to find out that what is the reason that the patient has come to this doctor and who has sent him. I mean, if the GP has referred, let's see here, then for example about treatment, if the patient denies, if the patient refusing means inkar, munkar. If the patient is not agreeing to give information, if the patient denies having any problem, sometimes the patient doesn't accept. Patient is a mentally problem. Patient is having a problem mentally, but he doesn't accept sometimes. He doesn't say that I'm crazy. No. He says that I'm okay. Other people say to me that I'm crazy actually. He doesn't accept. He doesn't think about it that he is crazy or he is mental or he is having any psychological problems there. So he says that if the problem is, if the doctor is asking him the questions about his sickness and the patient is denying or refusing to accept that he has this problem, okay, don't worry about it. Don't put him in any problem. Don't convince him that you have this problem. No, just be polite. See that if the patient is denying having any problem or is reluctant means not happy to do anything. If he is reluctant to start talking about himself, don't hurry him. If the patient is not ready to speak about his sickness or he is not ready to give information about his problem, then no problem. Don't hurry him. Don't make him, don't push him to do it with force. Don't ask him again and again that what is your problem? What's your problem? Yes, actually the main problem is this one. The main thing is this, that the patient should have a trust. If the patient has a trust on the doctor, then he can be happy, he can be ready to give all the information. So actually the first thing is to make a trust, to develop a trust between doctor and the patient there. Then he says that ask very beginning questions like how are you? Shufada, maktub hina. How are you? What has been happening to you? What has been happening mean what was your problem? Then what are the most important things about what are the most important things for your problem? What are the most important things? Another approach for hospital patients is to indicate why the GP referred the patient and then ask what the patient thinks about this. Yes, there's another way to get information about his problem that the doctor will try to understand that why the GP has sent him here. Okay, so then he can also find out there that ask what the patient thinks about this. Sit back and listen. Sit back and listen means that sit on your chair and listen to the patient. Okay, and without interrupting. Okay, noting exact examples of what the patient is saying. Yani sit on your chair, try to ask very polite questions, and whatever information you get from the patient, don't interrupt him. Don't stop him and write all the points on your file or on a piece of paper about that patient, right? And then noting means writing exact examples of what the patient is saying. Whatever patient is saying, please write all the points, all the important things. Take more control after about 3 minutes to cover the following topics. Take more control after about 3 minutes to cover the following topics. Now you're writing all the points, but for 3-4 minutes start writing all the points about the patient's information. And then these are the points which are coming after this. Presenting the symptoms. Presenting the symptoms means examining, checking, or analyzing the symptoms. Yani understanding the symptoms, understanding the arazul maraz, isharatul maraz. Okay, so you will try to understand other symptoms which are related to his sickness there, right? So in this way we have finished the first paragraph. First paragraph has been finished now, right? Yeah. Now any question about this passage now, about this first paragraph, please? Ask me if you have any question. Otherwise, we are going to start another passage. Right. Should we start the second paragraph?
Yes.
No question? Okay, good. Let's see. The second paragraph starts from here, presenting symptoms. Presenting symptoms, yani examining symptoms. Examining, checking, analyzing, understanding, or diagnosing all the things related to the symptoms of that patient. Now the doctor will try to understand all the symptoms related to his problem, and he will try to understand the actual reason of his sickness, in fact. For doing this, he tells you that first make a list of problems. All the problems related to psychology, make a list. Qaimatul Mushakil lil Nafsiyat. Okay, make a list of all the problems related to psychological sickness. Okay, when you have a list of all the problems, now you are listening to the patient, and then you can just tick it out. Okay, that he has this problem, he has this problem, he has this problem, he has this problem. So actually, he says that problem list. Make a problem list first. All the problems which can be any mania, depression, or suicidal thoughts, or plans, or actions, or anything. So then make a list of all the things there, and then try to understand all the problems step by step. Now go these points, go to this list step by step. Step by step?
Yes.
Yani one by one, right? First finish first one, yeah. Then you go to the second one. Then you go to the third one, and then in this way you go to all the things. STEP. STEP. Okay. Understand symptoms through different questions here. Understand different questions means try to comprehend all the reasons, all the symptoms with different questions. Ask him different questions, and in this way you can understand his symptoms. You can fahm, right? Because questioning is the only way with which you can get information from the patient. You will ask questions, then he will answer you. You will ask next question, then he will give you answer. And in this way, you are getting information about this. Huh? As he told you earlier in the first paragraph, that if he does not answer you, don't worry about it. Don't push him to answer. Don't make him don't force him to answer lazim. No problem. If he doesn't answer you, no problem. Yeah, don't hurry. Maybe this is your and his your patient's first meeting. Maybe this is the first meeting, and that's why he is not giving you the answer. Maybe in the next meeting or after that meeting, he will be a bit friendly. Okay, he can be very close to maybe, and then he can give you answers about this one. So he says that understand symptoms through different questions. Inquiries about his mood in the last week. Inquiries, ask questions about his mood, mizaj, okay, in the last week. What was his mood in the last week? How was he feeling in the last week, actually, right? and then he can give you all the detail about his last week's happenings or all the interactions with other people, right? So in this way he can have inquiries about his mood, ask questions about his mood in the last week, right? So in this way you can understand it. Now the next point that's very important, actually these are the parts of this problem, and the first one is suicidal thoughts. Suicidal thoughts means thoughts, afkar or thoughts related to killing himself or herself. That is known as intaha in Arabic.
Possible in the patient of blood. Things possible in the patient.
Yeah, possible. So it means that suicidal thoughts means that sometimes patients start thinking to kill himself or herself. First they make plan. First they make plan that how can he kill himself, and this is the extreme dangerous condition. This is khatir. Okay, zyada. So actually, first he makes plans. Okay, that I want to kill myself. How should I kill? He thinks about the ways. Turqul intaha. Yeah, there are many ways. Okay. Now, but he thinks that, and then even he can tell to the doctor that last week or 1 month ago I wanted to kill myself. I wanted to kill myself.
You can't give him some advice about this.
Yes. Then he says that sometimes he thinks about the plans, that how can he kill himself. Sometimes he acts upon all the points, all the plans. Qabl he makes it khutta, और बादन हुआ तनफीज़ al-khutta, यानी amal. He acts upon that plan sometimes, and sometimes he succeeds, sometimes he doesn't succeed in his plans actually. So actually he says that suicidal thoughts, so the doctor should try to know that whether his patient has any suicidal thoughts or plans or actions or not. So this is also part of that interview. Good. Because when the doctor will discuss about the suicide or suicidal thoughts, it means that the chances of suicide are decreasing now. Because after that, the doctor will definitely give him advice. Just advice that don't do it. This is haram. This is prohibited in Islam, and you shouldn't kill yourself. This is not good. And if you will do it, then you will go to Jahannam. You will go to hell. You understand? So actually, he can give advice to the patient that don't do it. This is not good. This is not good, and in this way, Allah will not be happy with you, akhi. Allah will not be happy. So actually, you have to be very careful for this one there. Now, other thing is depression. Depression, extreme sadness, extreme sad condition of a patient is a reason of depression. Okay, so actually, in depression, what happens? A person is in low mood. A person is in his very sad mood. Mizaj hazeen, kathir zyada. Right? Sometimes he says that he has no worth. He has no importance. Mafi muhim. He thinks, all the time he thinks that he has no importance in this society, in this family, or in this world. He thinks that he has no importance, in fact, actually. So in this way, he says that worthlessness, then he says that guilt. Sometimes the people who are in depression, all the time they think that that problem or that any bad thing is only due to them. Yani, I mean, this is the kind of feeling of guilty. Yani, ihsasul zam. This ihsasul zam all the time makes them unhappy. That hada kharab shay bas babana. All the time they think so. They think about it. All the time they think. Huh? Yes. You know about it. Yani, yeah, exactly. They think that this is my fault. This is my fault. And sometimes, you know that sometimes, for example, people get lost in the business. They get, a lot of, you may say that loss in the business. And then all the time, now they are crazy. They think, okay, this is loss. This loss in the business is my fault. And maybe they are thinking so much for this one that they are crazy now. That they are crazy because there a lot of money has gone. There a lot of money has gone now, and now they are thinking that this problem is due to my fault. Actually. This is my mistake. Right? Sometimes they make other kinds of mistakes. Okay? For example, somebody dies in a family. Somebody dies in a family, and then he thinks or she thinks that this is due to me. Exactly. If he is constantly or regularly thinking, then it means that he has this problem. Then he says that low mood, worthlessness, guilt, it's all my fault, and then biological markers. Biological markers means that some other signs appear in his body. What other signs? When he has a depression, he has psychological problems, but some other biological markers also start. How? Muslim, he does not have any appetite. He does not have any desire to eat food. When he doesn't have any desire to eat food, so day by day he is getting weaker and weaker and weaker, And in this way, the result is he is losing his weight. He got his weight loss. And his weight is decreasing because he is not eating. And in other way, sometimes he doesn't eat. Sometimes he has other eating disorders. Muslim, he doesn't eat properly. Muslim, he eats only one time in 24 hours. And this is also a problem. Okay? Muslim, he doesn't eat 3 times or 2 times a day. He eats only one time in 24 hours. Okay, because he does not, all the time he's thinking about his problem, and that's why he does not feel or he doesn't have any desire to eat food. So this is another problem here. Finish? Yes. Okay, just give me only 2 minutes. More in the last minutes. Then you have weight loss is there. Last point of this one, because today I'm going to finish this one. Okay, and in third period, yeah, we have, but we will start explaining this paragraph first. Then he says that mania. Mania is a problem. Mania is a sickness in which a person is having anxiety, or he has some, eating disorders and some other problems like this one. He has some delusions also. Okay, mistaken ideas, waswasa. Okay, he has these points there, and in this way, these are the reasons here coming. So anxiety and disorders are also in mania. He has some delusions, persecutory beliefs, then obsessional thoughts. Obsessional thoughts means some thoughts or some words which he cannot stop, which is uncontrollable to stop. Muslim, he washes his hand maybe 10 times, and he can't control. Waswas. For example, if he is praying, so after many times he thinks that his prayer is not good. So then again and again he is praying. Okay, then he again and again he is washing his hands. For example, if he is making ablution, then if he is making ablution, then what happens? That he again and again he thinks, this is not good enough. This is not good enough. So these are the reasons here, right? So inshallah, in the next period, in the next class, to explain. Yes, in the second paragraph.